Hey guys, welcome to another episode of Ask Dr. J. I often get questions from parents about their babies and when they're going to start teething and different tips and things that we can do to help them and comfort them through this process. People are born with 20 baby teeth and 32 adult teeth, except for special circumstances where we've seen extra, or what we call supernumerary teeth. That's a separate subject, but let's talk about those 20 baby teeth. When do they start to come in? So typically teething, or the eruption of baby teeth into the mouth, happens anywhere from the age of 6 months to 1 year. So there's quite a range, and babies will teeth at different rates and different times and go through the process in different ways. So I want to give you some of the signs to be aware of, because very often some of these symptoms and signs can occur months before you actually see the first tooth emerge through the gum. So first, sore and tender gums, that's going to be number one. Irritability comes along with that, right? If you have pain, you can be more irritable. It's the same with your little ones. Low-grade fever anywhere in the range of 99 degrees, excessive chewing, diarrhea, and then drooling, and especially a rash that comes around the mouth with excess drooling. So these are some of the signs, and just to be also mindful, if your little one has a fever of 100.4 degrees Fahrenheit or diarrhea, don't just think that it's teething. It could be something more serious. Make sure that you take them to your pediatrician to get them checked out to make sure it's not teething, and it could be something, again, more serious. So which tooth typically comes in first? It's different for many, but normally it's going to be one of your incisors, typically on the bottom. So it's a good idea for you to look in the baby's mouth, inspect their gums, see what you see, if there's any bumps developing, so that you can actually be aware of when that first tooth actually does come in. And again, some of these signs and symptoms that we talked about earlier may happen before, so just kind of be on the lookout. So here are 8 different ways that you can help comfort your baby as they are going through the teething process and really help get them through that more comfortably. First, massaging the gums can be very helpful. Make sure your hands are clean and lay your baby down on the bed, and you can just take your finger and massage the gums. Sometimes they'll often fall asleep if they're uncomfortable. It's very helpful, and if they wake up during the middle of the night, you can go back and do the same thing. The next thing that you could do is get a cold washcloth. So again, make sure the washcloth is clean, and with this one, make sure that you're supervising and watching your baby, because it can be a choking hazard. But clean washcloth, soak it in water, wring out the excess water, and allow them to chew on that, because a washcloth that's been in the refrigerator or freezer to cool it down and the baby chewing on it, it's going to give them a soothing effect with the cold on the gums. The third one is to use a pacifier or teething toy and actually put it in the refrigerator. We talked about cold being helpful. Babies like pacifiers and teething toys to chew on during this time period. So if you can take those pacifiers or teething toys, put them in the fridge to cool them down, and allow your baby to chew on that, it's going to help them, again, soothe the gums as the teeth are emerging or erupting into the mouth. Next up is to freeze milk popsicles. So a lot of times babies are not going to want to eat when they're teething because of discomfort, and one of the things that you can do is get some of those popsicle makers, make sure that they're BPA free, and you can either use breast milk or formula. Go ahead and put them in. There's a little stick that goes in there, freeze them, and now your babies can use that to get the nutrients that they need through breast milk or formula. I would warn you to be careful of this one because it can be very messy, so make sure that you have their bib on, maybe on a high chair. It can get messy. Number 5 is go ahead and wipe away the excess drool. Again, there's going to be a lot of drooling that occurs. Some people say this is why there's diarrhea that can be present or loose stool, but that drool also is going to form a rash or irritation around the outside of the mouth. So really be mindful of that. Get a warm cloth and wipe all that off the mouth so that there's less irritation and less discomfort. Number 6 is to chill some fruit. This is another way to give food when it's uncomfortable for the babies to eat. You can start with either frozen bananas. There's other fruits you can put in a mesh feeder that your babies can suck on, and some other things, maybe chilled pears, apples, strawberries. Again, it's a good idea to keep an eye on your little guys for this, because we want to make sure that they're not going to have a choking hazard. Number 7 is extra cuddling time. I think this one could help anyone that's in discomfort, but our babies, when they're having discomfort, you can sit with them in a rocking chair, you can carry them around the house, keep them close, rock them back and forth. These things are helpful to soothe them and reduce some of that discomfort. And finally, number 8 as a last resort is different pain medications. So the 2 ones that typically come to mind are Tylenol, and if the baby's 6 months or older, you can also use ibuprofen. Definitely check with your pediatrician on this, but Tylenol and ibuprofen for 6 months or older are going to help in more severe situations if the other things are not working, to really help soothe your babies when they're going through that process, that difficult process. It is a good idea to stay away from some of the teething gels and tablets that contain either lidocaine or benzocaine. They can be sometimes harmful and often numb a baby's mouth, which also can cause issues with swallowing. So we got through some of the signs that your babies may be teething and some of the tips that may be helpful. So how long does this process of teething last? Well, it could take anywhere from months to days. It's different for every infant. The pain typically will subside once the teeth get through the gum. There usually breaks between teeth, but the time frame ultimately can vary, just like with any other thing with humans. Everything is different. Pain tolerance is different, sequence is different, time is different. So the other thing that's important to know is that it's really important that we care for our baby's teeth. So I know they're gonna be lost anyways, but there's reasons for keeping them healthy. A couple of them being, number one, we wanna develop good habits for oral health care and keep the gums healthy so that when the permanent teeth come in, there's a healthy oral environment. And also, the baby teeth hold space for permanent teeth to come in. So if they do get cavities and are lost, it can create problems with space, which may make more difficult orthodontic treatment when your child gets older and the permanent teeth are coming in. So really make sure that you take care of them. You can start either with a washcloth and wiping them off, the baby teeth. You can use a very soft bristled brush, and there's even these little finger brushes that you can put on that have little knobs, and you can scrub the teeth with those to get them clean. There is trial toothpaste or training toothpaste that doesn't contain fluoride. I wouldn't recommend fluoride until at least 3 years of age. You don't want your child swallowing or eating a lot of the fluoride, but it is important again to develop these good habits, so get those started early. And scheduling regular dental checkups. Well, the American Dental Association says that you should bring your baby to see a dentist at the time when the first tooth comes into the mouth. I think it's important to establish a relationship. I think you may even want to bring your child in, if that happens, to your own cleaning visit, just to get them acclimated with going to the dentist in a non-threatening way before there's a problem. But bottom line is you want to get a pattern started, and you want to get it started early. So I know this was a bit of a deep dive on teething, what the signs and symptoms are, what you can do to help soothe your baby as they go through this process, some of the timing of when it happens. But if you're up at 3 a.m. in the morning with your crying baby because they're teething, I hope this was the video that you were looking for. Thanks for tuning in to another Ask Dr. J.